Welcome to labor and delivery postures. So this is absolutely one of my favorite topics to talk about, especially in our yoga teacher training, is how can we move through different postures to facilitate for both labor and delivery. So there is a difference. The postures are different because one is moving baby in towards the pelvis and the other, of course, is delivering the baby. So what does that mean? First, we have to kind of have a little bit of a discussion about the pelvis. So this is your bony pelvis, the female pelvis, very different than the male pelvis. And I just want to talk about some of the components that you'll need to know in order to move through some of these postures, or at least the language that I'm just about to use. So one thing is, this is of course the back of your sacrum. So it's made of your sacroiliac joints, which are right here. So these two bones that have a little bit of movement. It's kind of crazy, you can see me through there. Your sacrum is made up, of course, of your coccyx, which is your tailbone. These are your iliac crests, which you can palpate, and we'll just do that in a moment, but I wanted you to have a visual, at least with the bony pelvis. This, of course, here are, well, this is your pubis symphysis. This is cartilage. It has a tendency to separate, which is why maybe moms have a little bit of discomfort in the front of the pubic bone. And then these are your sit bones here, which are a little bit more forward than most moms kind of think about. So if we look at the angle underneath, we have the sit bones, your ischial tuberosities, and then your coccyx, which is your tailbone. These are your ischial spines, and then this is also where all the connection of your pelvic floor muscles are. So you can see that it kind of holds onto the pelvic organs. What we'll focus on today is kind of movements from here, these SI joints, which you can see kind of in between. They put the iliac crest towards one another and then hold it with the back of the sacrum. So they're really important joints that we need to know. If you have a lot of aching in the pelvis, this might be a reason why, because there's certainly, of course, a lot of pressure. What moms don't understand, as I mentioned, is when your baby is dropped, it doesn't mean that they've dropped into the pelvis. So this is half of the work of labor, is to move baby's head in towards the pelvic inlet. And then eventually so that we can move the baby out, which is delivery. So labor and delivery are technically kind of two different movements and two different postures and two different laboring. We have early labor and active labor. So just know and understand that when you hear the word that your baby is dropped, it doesn't necessarily mean that your baby is dropped in the pelvis, because that's the whole point of contractions. Contractions always start at the top of the uterus and they work down because it's helping to kind of move and push baby in towards the pelvic inlet and then towards the outlet. So in this position, what we're going to focus on today is moving baby, postures that will help move babies in towards the pelvis, and then of course postures that are going to help deliver baby. Okay, so here's the issue with laying on your back, which is I'm going to start here because I think it's really important. So when you deliver on your back, as you can see, when we're laying on our back and we have all this pressure, this is your tailbone, you cannot move in your SI joints. So the optimal birthing position is not the back. Laying on your back actually can compress your tailbone and your sacrum, and then a lot of women will have a lot of back pain. They won't be able to extend, so creating a back bend if you're moving on in your practice or even in your fitness journey and you're trying to do any extension in the back. When we compress the sacrum because we've laid on it for so long, some women can lay in labor for sort of 15, 16 hours if they've taken an epidural. So also what happens is it compromises the coccyx. In some cases, depending on the position of your baby, because there's anterior or posterior side of the baby, also the tailbone can kind of press up and back, causing a lot of back pain and extension. So if your healthcare provider says to lay on your back, just know that you have other options, which is what this whole video is about. What other options can I use so we can avoid laying on the back, so we can avoid progressive like back tension, tightness, and then essentially there are some women that will have the tendency to break their tailbone, especially if they're delivering on the back and the position of the baby's head. So one thing is that the optimal birthing position is not laying on your back. Anatomically, it makes no sense for women whatsoever. So what can we do to negate or move through better postures for our bony pelvis than a supine position? Just remember that these positions, the supine position, a mother laying on her back, is easier for you generally for labor and delivery, for doctors, for obstetricians. Usually midwives will have you lay on your side or in squatting positions, which we're going to go over. So this is why the back position, laying on your back, not the most optimal position for moms, because there's no movement. You cannot move in your SI joints. You can't, create ranges and different internal, external movement through your hips, which we'll discuss. Okay, so first thing, if your obstetrician, your doctor just tells you to lay in your back, just know that there's other positions that you can do, which we'll discuss. My favorite, just so I'm going to drop that seed right now, is laying on your side. So in a side lay position for delivery. So another topic is just anterior, posterior. So what that means generally, anterior is the front side of your body, posterior is the back side. So as it relates to the pelvis, when we do an anterior pelvic tilt, and I'll show you when I'm on the mat in just a moment, but if you're even sitting here, if you tip your pelvis forward as if the pelvis was a bowl, kind of drawing your sit bones back, that's an anterior pelvic tilt. Looks something like this, right? So if we're neutral here, sitting down, anterior pelvic tilt. What this does, it has a tendency to widen the sit bones. So this is a really great position for delivery of the baby once the baby's head is crowning. The opposite side is a posterior. This is where we tuck the tailbone down a little bit. So we move to the back side, the posterior side. This side's great because then it compresses the sit bones and it actually opens and widens that iliac, this space here. It looks a little something like this. So this is a better position. Posterior positions are better to help move baby in towards the pelvis. So we have an anterior pelvic tilt just to show you from this opening. It can open and widen the sit bones, better for delivery, right? Once baby's head is crowning. And then in the posterior position, when we squeeze and compress the sit bones, which I'm going to discuss as counter-nutation, we have the tendency to open that inlet a little bit more, which is great to move babies in towards the pelvis. So anterior, posterior, two really great things that I'm going to talk about, or at least cues that I want you to know and be educated with. So I'd love for you to join me on the mat now. If you can roll out your mat, find a space so that you can move through some of these postures to understand what I mean and piecing all of this knowledge about the bony pelvis together. So I think that understanding that we can move through these really small movements at the SI joints in our pelvis, that we can kind of shift between internal and external rotation with our legs, creating that, again, that room for either labor or delivery is really empowering to moms to know that you can actually articulate those movements while you're working with contractions in your breath is just such a phenomenal education to have as you move through labor and delivery. So first thing I want to talk about a side lay position. I love side lay positions for many reasons. A, it doesn't compromise the back. A lot of moms will have SI issues, so that's maybe sort of a throbbing in one hip versus the other. Sometimes it's in both hips, but a side lay position can actually be really nice for a mom who even has SI joint pain. So if you are in your early stages of labor, active stages of labor, and baby is kind of moving down towards the pelvis, side lay positions can be really nice. Also, they're really more about the optimal birthing position. So we're going to start on hands and knees, and I want you to make sure that you're really comfortable. And we're going to play around with this counter-nutation. And again, these are these really subtle movements at those SI joints. Okay, so if you're on hands and knees, please make sure that you're comfortable. If you're really far along in your pregnancy, you might want to even kind of kneel on something just to make it a little bit more comfortable. So these movements are really similar in our practice as cat-cow, but we're not actually going to move from our lumbar and our thoracic. So your lumbar is your lower spine. This would be a good indication here of our cow stretch looking forward, right? We're kind of tilting the pelvis a bit forward. This is an anterior pelvic tilt. And then our practice of yoga, we move into and we round that upper thoracic, and this is generally our cat position. And you can see that I'm now in a posterior pelvic tilt. So these are really common movements that we work with in yoga, but we're going to take them a little step further. And I want to show you, demonstrate how simple these positions can be, but the movements are really effective in labor and delivery. So on hands and knees, you don't necessarily need to look at me. I want you to just find a neutral position with your neck so your gaze looks down, and we're just pausing here for a moment. So finding a bit more of a neutral spine, you're not either in that anterior or posterior pelvic tilt. So hugging kind of the sides of the pelvis of the midline of the body, just lengthening and stretching the crown of the head forward. So thinking about your bony pelvis in this position, and we'll start to create a little bit of movement. So we're going to draw the sacrum forward, kind of towards your belly button, and lift your sit bones up. So in this position, we're now working into that cow pose, that anterior pelvic tilt. So the sacrum comes forward and your sit bones and your coccyx kind of lift up. Then we'll do the opposite position. So now I want you to move your sacrum back towards the back room and then kind of compress and squeeze your sit bones together. And now we're in that cow position, which is more of a posterior pelvic tilt. So once again, just draw the sacrum forward towards the belly button, lift your sit bones up. So it's a really small movement, widening the sit bones. So this is generally referred to as our nutation. Counter nutation is the opposite. So now I want you to draw your sacrum back, squeeze and compress your sit bones together. And this is your counter nutation. So once again, if you kind of look at the camera for just a moment, I'm going to show and you might even not be able to see my pelvis move too much. But the sacrum draws forward, sit bones and coccyx lift up. I'm widening the sit bones, pausing here. And then that counter nutation, I'm going to draw my sacrum back, compress my sit bones together, so I'm squeezing them, and now I'm moving into that cat position, okay? So anterior pelvic tilt, sacrum moves forward, coccyx lifts up. Posterior position, we draw the sacrum back, and my sit bones compress together. Okay, so I just want you to take a moment to draw your knees wide, reach the arms forward, just rest the forehead to the floor for your wide-legged child's pose for just a moment. And then we'll get back into that counter nutation as it relates to labor and delivery. So what's the optimal laboring position on hands and knees, and what's the optimal birthing position on hands and knees? So just take one more deep breath in. As you exhale, just slide the hands underneath the shoulders and we'll press forward onto all fours. So coming back to that those little movements, that counter nutation. So here we'll start. You're going to draw your sacrum forward, lift the sit bones and the coccyx up. So as you widen your sit bones in this position, this is going to be the optimal position for birthing your baby because we're opening and widening the outlet here. The opposite position, when you move your sacrum back and you squeeze your sit bones together, you're actually widening that iliac crest, which is going to be great for labor and delivery. So our posterior position, the squeezing of the sit bones, is best for labor and delivery. This movement here of sacrum forward, lifting your sit bones up, widening the sit bones, is an optimal position for delivery. Okay, so hands and knees can be amazing. So once again, just showing that with the pelvis, you can see a little bit more. When we created that anterior pelvic tilt, again in this position, we were widening the sit bones, so it opens. Right to the outlet, and then in the position where we were compressing and squeezing the sit bones together, we're widening here, allowing baby's head to move and descend in towards the pelvis. Great. So those two positions, hands and knees, optimal for both labor and delivery. Here's another one, squatting. Squatting is so great. Squatting position is moving us into an anterior pelvic tilt, sort of depending on the placement of the feet. It's internally rotating your thighs. When you internally rotate your thighs, again, you move the sit bones apart. So that's why it's the optimal birthing position. So if you were to take a squatting position, you can do so assisted, maybe with blocks if you want to, depending on how far along you are. I love squatting positions with partners, so I generally get partners, like your husband or your partner, to hold on to you. But in this position here, when we are in a squatting position, we're rolling the thighs in, right? We're in an anterior pelvic tilt, essentially, in this position. So when we're in an anterior pelvic tilt again, what's widening is the sit bones. So this is another really good reason why squatting position, anatomically for mothers, is one of your best birthing options to help birth your baby. Now, is it comfortable sometimes for obstetricians and doctors? No. They generally don't love moms squatting on the floor. You know, it's a little bit more, I wouldn't say it's dangerous for babies, because there's lots that we can do to help support babies as they are delivered, or at least birthed at this point. We can use towels, you can use blankets, anything that's going to help, and then of course mom's hands. But this is actually a laboring, or the optimal laboring position, just because the thighs are internally rotating and the sit bones are moving apart. So moms can also, if you're not sitting on anything, which you wouldn't be able to when you're laboring, but just for comfort, in this position, we can kind of lean a little bit forward, come into that anterior pelvic tilt, and then we can also control movements in our hips. So we can kind of move and shift, right? I can move a little bit externally. If you've witnessed a mother birth that's very aware of her body and her pelvis, these are some of the movements she might do. At some point when she's contracting, she might move between that anterior, posterior movement just to help kind of shift baby and move from hip to hip. So this is another reason why it's more of an optimal birthing position, but just anatomically so you know. Can you squat on the beds in the delivery room? Yes, it depends entirely on your healthcare provider. Another position to get into this kind of anterior pelvic tilt and squat is if you were kneeling and holding onto the bed, the back of the bedpost as such. So again, my thighs are internally rotating, my sit bones are widening, and this can also be a safer and better option in a hospital setting because you're on the bed, baby's a little bit more protected with the bed underneath, the obstetrician or the doctor's behind you, and you can kind of hug onto the bed. If you're delivering at home also, midwives are very skilled at moving you through different positions, so this is one that they definitely recommend, especially if baby is crowning or if you're working to that latter stage. And this is actually how I delivered my second child. So in this squatted position, tipping the pelvis forward into that anterior pelvic tilt, right? So we're in that position here of that counter nutation, and then drawing the arms forward. Optimal birthing positions. Another really great one is called Uttana Shishulasana in our practice of yoga, and it's extended puppy pose. So many different variations again. If you take a blanket underneath your knees, okay. Comfort is incredibly key when we're working some of these movements, and you can draw down onto the forearms in this position. So my hips are stacked over top of my knees, right? And you can kind of control the difference here between a posterior position, moving your sacrum back, squeezing and compressing your sit bones, which is going to be, again, great for moving baby in towards the pelvis for labor. And then if I do the opposite movement of drawing the sacrum forward, lifting the sit bones and coccyx up, now I've widened the sit bones and I've transitioned this movement also into a delivery posture. So we have a little bit of a posterior movement. We have a movement, an anterior movement. Okay, so this position also, you can kind of stay on hands and knees if you wanted to. Many moms like to take pillows, so this you can work with this one also in the bed a little bit. Can be comfortable. Just have to make sure over time, so that's why different positions are really mandatory. You will move from position to position because over time, as babies are descending in towards the pelvis, lots of things start to shift and move. You know, you'll start to see moms sway from the left to the right side, honoring that the babies are kind of navigating their way through the pelvis. So side to side a little bit. You'll always see moms start to move in different directions because they're feeling these sensations and trying to move baby through the pelvis. So that's kind of another nice one. And moms have the range of moving between that internal, external rotation or that anterior, posterior pelvic tilt, which is another important thing. One of my more recommended positions for delivery, but also you can use this in labor, is side laying positions. This one really doesn't have as much, I think, light shined on it as it should, because side laying positions are so wonderful. So depending, of course, on what's happening, where baby is, the position of the baby. So I have another video about your baby being face towards the pelvis. There's an anterior, posterior side. So we need babies facing towards the back of the sacrum so that their head can kind of move through the pelvis with a little bit more ease. When we have a position where the back of the baby's skull is resting on the back of the sacrum, that's what usually causes a lot of pain in back labor. So depending if babies are in this OA position, then we can move a little bit more and kind of help to draw babies down towards the pelvis with a little bit more ease. So that's the only thing that might interrupt some of these positions, of course, is the position of the baby, which we don't know until we move through labor and delivery. So side laying positions are wonderful. You can prop yourself up. I always recommend if you have SI joint issues, so if you're dealing with some SI pain throughout your pregnancy, lay on the side of your SI pain. That can actually sometimes reduce the amount of pain that moms are receiving on that particular joint. So you can take anything, blocks, props, something that will kind of help support you in this position. Moms generally, if they're in a hospital setting, they might have pillows stacked on top. Some moms just want to rest on the elbows. You even will start to move with whatever that feels the most comfortable. We have the hips stacked on top, but again, that will fluctuate just a little bit. But side laying positions I want to show. This is optimal for many reasons. One being moms can control here their knee towards the shoulder if they are in fact pushing. So the issue with laying on your back, as you've seen many, many times, I'm sure, in laboring videos, is if a mom was to lay on her back, okay, so this is the lithotomy position. This is the pregnancy or laboring position that we're most often told to do in our laboring settings. And then they have maybe a nurse on one side and their partner, your partner on the other. So the issue with this is you have two different people pulling your knees towards the shoulders, which is actually kind of shifting your pelvis. And so we want to make sure that in our postpartum health that we're being safe, but that you should be the one to hold this because you have the availability to kind of bear down using your own strength in this position. So if you are in this lithotomy position for whatever reason, have you take your own knees, take your arms underneath the knees if you're in a pushing position. The optimal birthing, again, because we're compressing the sacrum, not really great anatomically, is to lay on your side. So you can do the same thing laying on your side. In a delivery setting, of course, baby's head's now crowning. You can take your hand underneath your arm, kind of hook it here, hold on, but then you give yourself the availability to bear down with your own strength, and you're not working with those two different fluctuations. So one of the benefits to a side laying position here. Also, if I'm in a side laying position, I can internally rotate my thigh, right, in this position, which again opens up and creates space between those sit bones, which opens up and gives more room for delivery. External rotation, what we're working with, it kind of compresses the sit bones. External rotation gives you more laboring movement, right? Because we're opening and increasing this in the pelvic inlet, right, as baby's head moves through. And then the opposite position, when we internally rotate, we're widening the sit bones, which is delivery. What I like about a side laying position too, maybe sometimes you want to feel like you want to open up a little bit, right, to create space, depending on what baby feels like, if you want to create a little bit of internal rotation, but you can do so on a side laying position. Either on my left, you can roll onto your back and switch over to your right. Many moms have done that. I myself have done that in labor as well, because not one position feels good all the time. You have to kind of keep moving. And even if you've had an epidural, in your in labor, you can also do a side laying position. You might just have to have someone help you roll over to that left or right side, but you can still lay on your side. So the optimal position, again, this one's probably the easiest if you're delivering in a hospital and you have an obstetrician and a doctor who wants you to be on your back. You can say, of course, this is your birth. You are empowered to say, I would like to deliver on my side. I feel more comfortable on my side. If baby's heart rate is fine and the doctor doesn't seem too concerned, they will let you lay on your side to deliver. And then you have the ability to move again. Internal, external rotation, little posterior pelvic tilt and that anterior pelvic tilt. You at least have the mobility to move. When you're on your back, you have no ability to move. So side laying position, I'm just going to switch sides. Again, optimal birthing position. You can even lay with your arm up overhead. There's so many different things that you can do here, but pushing, one thing, right? You're maintaining that control, what's happening with the shifting of your hips. You can move your thigh in, internally rotate to create space. Pausing here, you can sort of shift back. Anterior, posterior movements, at least you have the ability to move, which is also why side laying positions are one of the better ones. So in terms of your labor and delivery posture, again, I hope I've given you some education. So laboring postures, I don't have my little baby here today. Laboring postures are to get babies in towards the pelvis. Remember, that's the work. So I say this time and time again to moms because even I was unaware with my first that, when I heard that my baby dropped into my pelvis, I was like, oh my gosh, great. My baby's like in here, in the middle of the pelvis. This is so awesome. It's just going to take a couple hours to deliver the baby. No, the work is moving. It's getting baby to move in towards the pelvis. That's what active labor, early labor, and active labor is. Everything is happening. It's starting to move and transition. So laboring positions are helping. Okay, so we want to think about, again, widening this space, compressing the sit bones, opening up, right? Moving into some of that externally rotated positions. And then when we feel there's a lot of rectal pressure, we feel as though, baby maybe you've been checked and you're 10 centimeters dilated, but the baby is maybe at a station of +1 or 2. This is where you know that you're going to start to transition into more delivery postures. Delivery postures, when we're more into that anterior pelvic tilt, we're trying to think about widening the sit bones in this position to create space, also allowing some of those pelvic floor muscles to help to stretch and open so that we can have a little bit more of a conscious and birthing experience, but also so that we don't really challenge and compromise some of these tissues and muscles. That's the most important thing. We're trying to kind of reduce the risk of tearing. We're trying to reduce the risk of pressure on some of these pelvic floor muscles so that your postpartum is just that much more healthier and that you're moving through it with a little bit more ease. So if I can offer any advice, it's just knowing and understanding that A, this is your birth. You have the availability to say in the way in which you want to birth. If you are unable to convince your obstetrician or your doctor that the back is not a position that you want to work with, please, lay on your side. Know that you certainly can do so. Squatting positions, optimal, both. That's more of a birthing position because we're internally rotating the thighs, sit bones are moving apart, and then also hands and knees. Wonderful position for moms, of course, because we can work with between those labor positions and then the delivery positions, the anterior, posterior, that nutation and counter nutation. So I hope this video at least helped you a little bit with knowing and understanding that there's different positions. There's so many other things you could do. I just wanted to keep this more yoga related. I wanted to give you a little education about the bony pelvis, that we can actually move very subtly at these SI joints and how to move between that anterior, posterior, external, internal rotation, which is really important for labor and delivery. If you have a doula or a midwife, they're so skilled at moving you into different postures. If you have someone, an aunt and uncle, a cousin, your mother there, so great. There's the birthing balls. There's so many different things that you can do, which is really great. I want you to be as educated going into your labor and delivery as you can so that it's your postpartum healing that becomes a little bit more easeful. So I hope this video helped you out a little bit. There are so many other positions. I wanted to keep this very yoga related. What yoga postures can we use for labor and delivery? I needed to give you some education on the bony pelvis because I feel like there's not as much education. And I, again, just gave you really basic information, something that will help to empower you on your journey into labor and then, of course, to birthing your beautiful, beautiful baby. So educate yourself as much as you can. There's also some wonderful education or videos out there about the birthing balls, the exercise balls, how you can use them, incorporating one into your labor and delivery, which is wonderful. I've just given you some information here about some postures that you can use, either if you're laboring at home or if you're delivering in a hospital, some of the things that you might see and might consider. Please let me know if you have any questions. I bid you the most success, light, and love for a healthy delivery and for your healthy and wholesome postpartum recovery. So just remember, moms, to stay connected. Stay connected to your body, stay connected to your breath, and stay connected to your baby during this journey. Namaste. You got this.